Moving right on in. Well, we are on to the coroner, so we are ready to go. Wait a minute, we didn't blow the schedule, did we?
Yeah, we did.
Oh, it's 10 after?
Oh, yeah.
Oh, wow.
We did.
I can't keep time, I guess. Yeah, we did, we did blow the schedule. We're way past time. All right. Well, let's move on to the Franklin County coroner. Oh, sorry. Thank you. I did not sneeze on you. I did not sneeze on you. All right, the floor is yours.
Good afternoon, honorable board, and the rest of the team, of course. My name is Matt Cottle. On behalf of the elected coroner, Dr. Anthony Ortiz, I'm the director of operations and my esteemed colleague. Oh, sorry about that. Thank you. Would you like me to start over?
Only if you need them to for the record.
Oh, yeah. Good afternoon, honorable board and the rest of the team. My name is Matthew Cottle. On behalf of the elected coroner, Dr. Anahí Ortiz, I am the director of operations for the Franklin County Coroner's Office, and my esteemed colleague to my right is Beverly Harper, who functions as the chief fiscal officer and the pillar of the agency, if I might add. So first off, if I could begin with the 2018 budget brief, we'd like to thank you for your overall support of our agency. It has been certainly a challenging year, as it has been since I came to the agency a couple years ago. Each of the departments typically sustain a 9 or 10% growth impact, which just means busier, tired folks. But it frankly is a mission that is community focused, and every one of the staff members to our newest hire appreciates that, and we realize on a incredibly bad day for our clients, it is our opportunity to try and make a little more sense out of things for them. And we do that in a robust manner every single day. And without your support, we would not even remotely have a chance of being successful. So I'll continue my thank you tour. I'd like to remind people, this is our old yet current location at 520 King, and as a result of your actions, you're preparing us to move, hopefully soon, the end of 2019, to our new Forensic Science Center on Frank Road, the southwest part of the city, and we are busy preparing for that even as early as today. So Dr. Ortiz, she has really changed the face of the agency, and I think I'd be remiss if I didn't bring up the fact that a 30-year pediatrician who works with at-risk youth as a profession coming into the coroner's office has frankly allowed opportunities to provide some cultural engagement with our staff, some professional development series that have been issues at hand over the last couple years, and certainly it is focused on our efforts on child fatality review and the sudden unexplained infant death syndrome that unfortunately plagues us here in Franklin County, as well as other items of measure, and we work every day to do what we can to produce any type of intelligence or data that we can share with our partners to hopefully prevent that. As I had said, the Franklin County Coroner's Office is a community-focused agency, and our service population is frankly difficult to measure. 1.2 to 1.5 million people currently reside in or around the Central Ohio area. We provide service to somewhere between 15 to 20 counties, as it, by design, Columbus is blessed to have numerous trauma centers. So you'll hear a term that I talk about today called out-of-county cases. These aren't necessarily cases that originated with an injury that occurred within the jurisdictional confines of Franklin County, but nonetheless land here because we have an excellent healthcare system. So those are very taxing. It's very difficult to predict the numbers, and we respond as best as we can, and I'll talk a little bit more as we get further into the brief about some of the measures that we've taken to make sure we pay respect to providing good service as we determine cause and manner of those cases that unfortunately result in mortality, but also to be as budget conscious as possible. So our office is guided by the Ohio Revised Code Section 313, specifically .12, that defines non-natural deaths falling under the jurisdiction of the coroner. And frankly, the crux of the code is to make sure that we do a very good job of being diligent in determining what the cause of manner is relative to that non-natural case. The divisions of the Franklin County Coroner's Office range from the leadership drop off.
It looks like it's on the
did.
red.
Yes, it did.
Is it off?
Battery may have just died.
Maybe, but the red button is on.
Oh, sure, yeah. Okay, so the divisions of the Franklin County Coroner's Office begin, but it's certainly not the most important division, with the leadership team, the case management team. We have a forensic toxicology department as well as a forensic pathology department, the investigations team, and those folks that work in our morgue and the histology section. The leadership team, of course, led by Dr. Ortiz, comprises myself and Bev and Dr. Ortiz, and also Dr. Gersten, who is our current chief deputy pathologist. And we meet monthly to strategize. You know, how can we become as efficient as possible in case closure, turnaround time on those cases on a day-to-day basis, quality measures, partnership, other efficiencies. We had talked about some of the out-of-county cases, and historically, we had, in dealing with out-of-county cases, we had provided to the referring coroner almost gratis in their selection of what type of examination the case they referred to us would have. And what we find is there was actually a gap between what we thought our referring coroners wanted rather than what they really wanted. And frankly, they were looking for us to provide a forensic pathology consultation. So in our engaging and scrutinizing, if you will, the cases that were referred to us via out-of-county, we would have a callback system. We now have a callback system in place where our pathologist would call the referring coroner to discuss the forensic value of doing a type of case. Whereas we would just wholly understand or respect that they had requested a full autopsy for this sake of this discussion, when rather a view with toxicology alone would have sufficed. Cost savings notwithstanding, really it's the best thing for the family not to put them through a needless procedure. So we've closed that gap, and we've put in what I would consider a very important process within our pathology department. There's other downstream positive implications, if you will, to doing that. But that's a measure of the success that our leadership team has brought over the last couple of years to discuss and scrutinize those. The case management team. This is what I like to call almost our first line of offense, not defense. When persons visit our coroner's office, they're admitted in through this glass area, or if they call our general number, they get a first voice on the phone. And it is very important, and we reinstate this and reinforce this every day, that our general staffers, our leadership team, are cognizant as they go about the business of the day that although this may be their 10th autopsy of the day, this is the first for the family. So they need to hear a smile through the phone, they need to see a smile at the desk, and we need to take every attempt possible to preserve their dignity as we go about explaining to them something that they're just having a really hard time comprehending. This team is a team of 4. They manage all of the case documents. They receive, on average, records requests numbering about 20 a day. Currently, our 5-day turnaround time, as mandated by law, is 85%. Our goal for the coming year is 100%. It's always 100%. Next, please. Our pathology department, as headed by our chief deputy coroner, Dr. Gersten, is a team of 5.5 in the recommended budget or proposed budget. What we're suggesting is, rather than an additional pathologist brought in, we currently have a 0.5 FTE full-time equivalency. And what we have asked through conversation with the O&B director and the county administrator is that we reform that position, if you will, and move that from a 0.5 FTE to a 1.0. What it effectively does is preserve our National Association of Medical Examiners accreditation, which is a huge, huge concern. The prosecutor would certainly concur with that. Effectively, we have a projection of 1,760 cases that we would expect to have to autopsy through this year, and it allows a division of a workload that drops us below that very critical Phase 2 violation. There's still threat for Phase 1 violations to occur, but a Phase 2 violation is, we've avoided those. We're extremely close this year, but because of the recommendation and hopefully your approval to that 6.0 FTE rating within the pathology department will allow us to divide those cases that will be coming in through the years and drop us below that threat level of receiving that Phase 2 violation, a key concern for ours. The forensic toxicology department is led by our chief toxicologist. Dan is a fantastic academic professional and forensic toxicologist who self-imposes deadlines well below what the national standards would be. The average turnaround time for our cases, even as the number and complexity continue to increase, are somewhere around the 35-day. We've had some situations where we were about 40 days from the time they receive the sample in the toxicology department to the time that they finish the final report. Our goal is always 30 days. The National Association of Medical Examiners is well above that, and we strive to make sure that that isn't the issue. As a matter of fact, as of today, some of the things that have been afforded to us through the general fund, we've received a new nitrogen generator, which supplies the gas to the equipment, and as we speak now, we are opening bids downstairs for a new GCMS toxicology equipment to bring another online, because frankly, what we're faced with here in Franklin County is not only just opiates, there's many other things. It's the illicit analogs that have increased the complexity of these cases that have slowed down our process. We're very proud of turning around case closure, if you will, at 8 weeks. We're somewhere between 10 and 12 weeks now, which is not anything that we're proud of. The national standard's 6 months, incidentally.
Really?
But that's not the type of work that we do in Franklin County. So our goal is to get back to 8 weeks in light of the fact that, again, the number of cases and the complexity of such fentanyl and its illicit analogs are just making things very, very difficult for Dan and his team. But because of the funding measures, including the one that's going on right now with the bid opening, we expect and will require of ourselves to get back to that gold standard. The investigations and morgue operations, it's a team of 10 investigators, including supervisors and five morgue technicians or pathology assistants. We have 2 positions that fall within those departments for 2018. And if you would consider a brief overview of the counterparts in our region, Franklin County, our projection is over 3,900 calls for service. Actually, I'm sorry, that's not a projection. As of 11/27 of 2017, we actually had 3,902 calls for service. It averages about 80 hospital calls a month, 100 scenes per month, and those scene projections continue to rise. We would expect about 1,230 calls in 2017. In 2016, our investigators responded to 924 scenes. So it was a marked increase. Hamilton County, as a brief comparison, performed 750 scene investigations, and they did that with 6 full-time investigators that work Monday through Friday, normal business hours, and 9 part-time investigators who cover those after hours. So they had a total of 15 staffers to cover much less of an impact than what Franklin County is experiencing. Cuyahoga County, they have 13 full-time investigators, and they cover about 1,000 scene investigations. So we're being as efficient as possible, and the adage of doing more with less, if you will. This is our current autopsy suite. It's 3 autopsy stations, 2 in one room and 1 in another room. That isolated room is engineered a little bit differently. We use it to restrict the number of persons that can go into that room, because we use those for homicide cases, as well as the cases that are experiencing decomposition. The new Forensic Science Center, you can extrapolate that and magnify that 6, 7 times over with an opportunity to actually increase that. We have significant issues, I don't want to say issues, we're managing some challenges with our turnaround time because you can see the configuration. This is a circa 1970 building, so when I call it our old place, it is our old place.
Oh, I've been there.
Absolutely, yeah, most of you have multiple times. The new Forensic Science Center, just the efficiency of that because of the engineering is something that, well, we're all absolutely excited about.
Well, and Commissioners, I would add to what Matt was saying as well. In the new facility, the current best practices is to have the ability behind glass, but with the ability to communicate with the pathologist for law enforcement or other experts who are there to witness an autopsy. Right now, those folks need to be physically in the room with the
That's correct.
pathologist.
I know.
And so that best practice will be built into the new facility, which is significant.
It absolutely resolves our cross-contamination
Right.
concerns, 100%.
And I would be concerned about that as well.
Yeah.
While we're going back and forth, I'd like to just ask with the out-of-county autopsies that you talked about and now being more efficient with that, are you doing any cost recovery for those now?
Yeah, absolutely, ma'am. Yeah, one of the efficiencies with the case secretary unit, the billing used to be comprised there, and what we found is there's an opportunity to recover about $400,000, $410,000 in billing for those out-of-county cases, and frankly, we weren't coming anywhere close to that.
Right.
So one of the additional duties that one of our new hires, it was a replacement position, was for the assistant to the coroner to take over those. We've been much more effective. We've leveraged some partnership with the Franklin County Prosecutor's Office to kind of clear up some interpretation. And what we had found is we had the opportunity and really assigned a subject matter expert that we just happened to have hired as the assistant to the coroner, frankly, that we found that there was maybe some misunderstanding with the out-of-county or the region coroners as to what was billable and what wasn't. So we were able to work with the prosecutor, clear that up, and our billables are much more positive in light.
Okay, thank you.
Yeah, absolutely. In the morgue, as I highlight that, we have a challenge, as I had said earlier, and one of the positions that is contained within the 2018 budget is another pathology assistant, and that is to maintain that ratio of 1-to-1, which we currently do not have. There is a new process that we're going to be able to engage with because of that ratio, where one of those individuals will be working in what's called a dry position. Currently, with the composition, everyone is kind of scrubbed in, and when you have things like having to answer the phone or deal with an external partner, a funeral home that shows up, we would either have to delay them or we'd have to delay the case by that technician breaking scrub. We don't have to do that any longer, and the prediction is that we will be reducing the time of each case by about 30 minutes and the time to recover from a case and start a new case by about 15 minutes, which equals, in this building, an increase of capability of about 3 to 6 cases per day. So it's not unheard of, but it's not common, but it does occur that we have cases that have to be bound over for the next day's schedule, and that is a huge dissatisfier to the family. It's a burden, as our job is just so difficult to predict from day to day, and we just do not like to do that. We like to clear those cases and quickly move those cases onto the family so that they can have their bereavement time with them. So we thank you for that. That's an important but not highlighted position, frankly. So under some of our other duties, aside from our daily duties, the outreach opportunities that we had talked about, we host medical students and residents, fellowships. We do interagency briefings so that we can learn how to better partner with our folks, aside from the law enforcement agencies. We have engaged in a professional development series that we provide to all of our staff members, cultural sensitivity training, where we host other members of faith-based communities to come in and share their stories with us so that we better understand how we can serve them. something that's frankly been really well received with our staff over the last couple years. Next, please. The health-related outreach continues as this agency has a great history of supporting Lifeline of Ohio, the Organ Tissue and Eye organization. Typically, the coroner sits on the medical advisory board, and that continues today. Another donation partner, the Central Ohio Lions Eye Bank. Both of those, the partnership, we would expect to continue to increase in a more robust manner as we have a better opportunity to partner with them and provide those that have consented for donation a real opportunity to do so with the design of the new Forensic Science Center. We will actually, rather than hold up our daily schedule, though there will be an area that will be reserved for them that will serve a dual role for mass fatality for us. So in the event that there isn't a mass fatality going on, the donation partners will have an area where they can come in and actually do their recovery, and it will not impact the daily operation. So we're thankful for that in the design. We have another, the local outreach to suicide survivors. I know that this is something that's been briefed to this board before. We have a grassroots, vetted, trained community of persons that when someone is suffering because they've been impacted by suicide and they're looking for a resource, they're looking for someone to come and be with them that's had a similar experience to help them grieve. We have a team that is available 24/7, 365, just as ours, and they've trained with our investigators to go together upon request and help serve that citizen in Franklin County, and that relationship continues today. The opiate epidemic, much has been spoken. You know, the Narcan training continues, the support of the community action plan, its goals and objectives continue, and one of our focus of efforts, if you will, is to make sure, and we had talked about trend and morbidity data, and we're the warehouse for that. And we know that we need to be really good and timely and efficient and post numerous updates. And that is our goal for 2018, because what we do understand is before someone becomes morbidity data, there's a likelihood that there's mortality data. There are definitely lessons learned within that, and we need to share that widely with the whole of government, outside of local public health and others who have a vested interest in doing that. And hopefully we can turn around some of the dangerous trends, the deadly trends that are child fatality review and the traffic fatality reviews that are out there that we participate in. And if we can broadly share and do so in a timely manner, hopefully that there will be some lessons learned, and we can really focus on some community and education efforts to reduce and turn those trends around. The disaster planning, a supplement, if you will, to our budget. We were successful in partnering with Franklin County Emergency Management and Homeland Security. Last year we were awarded a $200,000 grant to bolster our capability and our plan within our agency, Franklin County as a whole and the Central Region as a whole. The good thing about this is the grant stream is the State Homeland Security Grant Program. Franklin County EMA is our fiduciary agent, and that program comes up for a rebid every year. And this year we've been told there was $600,000 available for the year that we won the $200,000 grant, which was challenged by 15 counties, by the way. So we were able to secure a third of that. This year the funding is over $700,000, and we have needs, and we're going to make that effort to do so. We've also partnered with Franklin County Homeland Security and the Justice Program, and Franklin County, as you're aware, was awarded over $800,000 to prepare for complex coordinated terrorist attacks, the Brussels, the Belgiums, the Paris-style attacks that fortunately haven't visited us here, but in preparation as such, we joined in with our partners. We were successful in being bid and being awarded. Our allocation to our agency is about $90,000 to help us prepare for those efforts. Next. So our 2018 goals is managed with a high level of quality, the operational demand exceeding around 10% per year in each department. Certainly maintain our name accreditation. We are in the process of working with the OMB director's staff in completing an integration of the performance metrics and making them align with the National Association of Medical Examiner metrics. Continue partnership with the project team and leadership toward completion of the new Forensic Science Center. We're going to complete an update of our information management system known as Justice Tracks. We hope to have a successful onboarding of 3 new staff positions. I guess the qualification should be 2.5. Apply for and be awarded the State Homeland Security grant monies for the purchase of diagnostic and fatality management services equipment while we continue our work with the Central Region in fatality management services. An increase of fulfillment of public records requests from 85% to 100% within 5 days. Our pathology goal would be to manage the caseload while providing appropriate service to the region, maintain completion of our cases within 60 days within the pathology department, recruit quality candidates for the approved position, the 0.5 to 1.0 FTE, and avoid any phase 2 violation. The investigations goal would be to complete the field training for 2 newly hired investigators that serve with us today, recruit a quality candidate for the approved position within the 2018 budget, and then maintain completion of cases within the investigations department of 30 days or less. The toxicology department goal would be to implement the new GCMS equipment at below the budget. We secured this through the bid process, maintain their case completion of case of no greater than 45 days, with the gold standard being the 30-day. And of the morgue, to recruit a quality candidate for the approved position. One of the other things I should say about the morgue is we established what's called a census. And we manage a census. Our goal is always to have less than 18 decedents in our possession at any one time. And there's a number of reasons for that. Chiefly, it's for the families, of course, to be returned their loved one. But secondarily is, should there be an event, it doesn't have to be a complex coordinated terrorist attack. It could just be a traffic fatality that has high occupancy. What we never want to see is a cold storage trailer in our facility parking lot. And one way to actively do that is to always focus your effort and manage daily your census. And our census peaks, but we always work to get it underneath the 18 gold standard. And with that being said, this concludes my brief, and I'm certainly open for any questions that you might have, and I thank you for your time.
Thank you, Matt. Got quite a lot of challenges. I don't have any questions.
I have just a couple of brief questions. One, I want to say that it's important for the public to know that in the coroner's office, anybody that passes away comes through the coroner's office, correct?
Non-natural, sir.
Not natural.
Yeah,
Right.
death notification occurs, and then there's a discussion that ensues as to whether it appears that it might be non-natural. If it is, then we make a determination to assume jurisdiction.
No, I thought I remember my grandmother passed away, and I was there. The morgue's office was involved. Why was that?
Without knowing the details, it would
Yeah.
be difficult to answer. A common case is, frankly, a private practicing physician refuses to sign the death certificate, or the death was unattended, meaning there was no one there when it occurred.
Okay. And the point I was making was that I was trying to make was that, in one way or another, you impact a lot of people. It's because it's the families of the deceased and so forth.
Absolutely.
And so that being said, I just want to focus on 2 really quick questions. One, the majority of your funds are general fund dollars. Is that
Absolutely.
correct?
Yes.
Is that 100%, 90%? Okay,
Yep.
so the majority is general
Other
funds.
than the small
Other than the,
grants.
yes, there's maybe a $6,000 Coverdell grant that helped purchase supplies for toxicology.
Sure.
The disaster planning grants that we spoke of today are new.
Okay.
So we're almost wholly supported by the general fund.
Okay, so then my final question is, with coroner's office is obviously a function of the Ohio Revised Code to provide this, so the county is to provide this service. So it's a mandate for us to provide if we were to have to make cuts, how, is it discretionary, or is there elements that are sort of base level? And the reason why I'm asking is because, as you know, we are considering extending the current sales tax rate and making it permanent. If we don't do that, the county, Franklin County, is looking at substantial cuts, not just immediately, but over time for the next several years. This budget is an indication, because it's general fund, that the coroner's office would be affected by that.
Significantly.
Yeah, and so what I was trying to figure out was what portion of that budget is cuttable if we do that versus, because if none of it is, then that means there's going to be more on other agencies like JFS. But if some of it is, then it still is a reflection of what they deliver and do.
Kendall Wilson, County Administrator. Commissioner Boyce, President O'Grady, Commissioner Brown. While to do autopsies are a mandated activity, there are aspects of doing autopsies that would, under circumstances in a county that has to cut back fiscally, would look at. You would have to look at having fewer pathologists to do autopsies, which means you have higher number of autopsies per pathologist, which puts things at stake, such as certain accreditations. Or it means that bodies will, in places where they've had to cut back, bodies spend longer in the coroner's office awaiting those autopsies to take place. So to say that in a scenario, let's just say what we're talking about this morning, if there was an expiration of the sales tax at 12/31/18, the budget director, Zach Telerik, and I would be looking at those 9 to 14% cuts that you have to look at when you have to look at everybody.
True.
Or you leave a position, you leave positions vacant. You may have to leave a morgue tech position vacant. You may have to take longer on being able to get investigations done. All of these things cause delay when you have fewer resources.
Sure,
But
thank you.
that really impacts the families of those who have passed, and
And the judicial system.
the judicial system as well, who are waiting. But really, if we're looking at how waiting for an autopsy result affects a family who really want to understand what happened to their loved one, that would just be devastating to have that delayed. You know, the accreditation aside, to take longer to do the autopsy and get those results.
So when it's delayed, who do you hear from first, the family or the prosecutor?
It's usually 3 family members.
Yeah.
So it's likely that. And yeah, the delay goes from law enforcement, the assigned investigator, the prosecutor. You know, one of the items of note is if there is a religious concern,
Yeah.
you know, we have the ability now to move cases around to pay respect to that. So that is something that we do, and that's a 24-hour, a sundown
Right.
rule, if you will.
And that would affect my family.
That's
being
difficult to do
Jewish,
today.
And that would be very
Yes, ma'am.
difficult,
Yep.
because we do burials
Mm.
within a day.
Oh, yeah.
And it would be very difficult if
Sure.
it was an issue.
It is with our current situation.
I know. And it would be even more difficult
Sure.
and more challenging. Yeah.
I mean,
Yeah.
we talked about it this morning.
Oh,
You know,
yeah.
basically when we talk about, which the coroner's office is one of our partners as far as, when we talk about safety and security, those dollars, 6 out of every $10
Yeah.
is right here, when we talk about these things. And there's consequences to not having revenue available, because we have to take care of our essential needs and protect the county's financial status, bond rating, et cetera.
And nobody wants to think about the coroner. You know?
Sure.
It's not an office anybody
Right.
really wants to
Right.
think about. And yet, your service is very important.
Thank you.
So, thank you. And thank Dr. Ortiz.
I will, yes.
Okay,
Thank you.
Thank
thanks, guys.
Yeah, thank you.
Let's move to the sheriff. So, Jews don't like cremation. Is it forbidden?